Randy, either in palliative care or hospice, have you ever seen an example of somebody giving up?
No, I can't say that I have. Especially, I think it's not just about when people feel like they are concerned about the idea that either family or friends or even in themselves, that by electing hospice is somehow they let people down or they gave up on themselves. I can understand that patients might feel that way and they have to kind of process that emotion. But what I see actually on the other side of that, based on what I witnessed firsthand on the team that's surrounding this patient and family, they're doing anything but giving up on this patient, right? The staff, the hospice nurses, the chaplains, the social workers, I mean, they know that this is their time to roll up their sleeves and to make that patient feel like the center of the universe in a way that they probably should have felt for decades before when they were first diagnosed. Or even years before in the case of some cancer diagnoses that have shorter trajectories. No one in this side of the world is feeling like when you've elected and kind of stepped into the care of hospice, nobody in the hospice team feels like, okay, you're here now. Okay, let's just get this on. It's very much not the case. They are very focused on giving the most quality of life that can be given. And what's really fascinating about that is when people are actually well managed with their symptoms, there's an actual science on this where, when we're fighting our pain, when we're fighting our shortness of breath, when we're fighting all these symptoms that are ailing us, we're burning calories, we're burning up reserve. And that, does shorten our lifespan. So if we can find a good balance between treating those symptoms, allowing ourselves to have the relief we need, we can actually conserve some of that energy. And over time, that accumulates. You make a little bank of energy, and it actually buys you additional life on the other side of that. So the research supports that patients that come on hospice do have extended lifespan in many cases because their energy goes towards just doing the things they love versus trying to fight and use all their reserve to combat their symptoms.